All righty. So I want to welcome everyone to Cancer Support Team, Cancer Survivor Support Group meeting. Tonight we have an exciting presentation, and we're going to talk about some common questions that people ask about cancer. Now, before I move forward, my name is Karen Holm, and I'm the founder of Cancer Support Team. Our goal is to empower, inspire individuals impacted by cancer. So at this point, we are going to go live on Facebook.
Mm.
I'm waiting for it to pop up. Are we live on Facebook? I don't think I hit it hard enough. Here we go. My computer is running just a little slow, but right now it's loading for Facebook Live. Just 1 second. And we are live. All righty. I don't know why my computer is really going slow. I believe we are live on Facebook. I don't see my icon as yet to show up on my screen that says we are live. Okay. Welcome, Facebook Live. My name is Karen Hall, and I'm the founder of Cancer Support Team. Tonight, we are going to do a presentation on Welcome, Facebook Live. We are going to do a presentation on Welcome, Facebook Live. Yeah, hold on 1 second. This is what I didn't want to happen. Hold on 1 second. This is what I didn't want to happen. Hold on 1 second. Okay. So we are still Facebook Live. I just had to close Facebook Live because I was getting the feedback. And so tonight we're going to have a presentation on common questions about cancer. And so if you have any questions, please let me know. All righty. So let's start off with, come on. What is cancer? You know, we're talking about common questions about cancer, but what is cancer? Okay, cancer is a genetic disease. Okay, cancer is not anything you can get from a person that has been diagnosed and you shake their hand. Okay, because there are times where people are afraid of you because when you say you are diagnosed with cancer. So let's clear up and make the fact known. Cancer is a genetic disease. The genetic changes that causes cancer occur when there's an error in the person's cells and the cells divided. Oftentimes the cells divide and sometimes we have bad cells. On a normal basis, those bad cells die off. When we are diagnosed with cancer, those bad cells mutate, okay? The second cause is damages to your DNA, right? And it's caused by a harmful substance in the environment, right? And then lastly, and I'm going to say lastly because the majority of the time, the person is diagnosed with cancer is not inherited from the parents. That's only about 20% of the cancer diagnosis is inherited from the parents, okay? Then when we talk about this abnormal cells may form tumors, which are lumps in the tissue, right? And tumors can be cancerous or non-cancerous. Have hit my next button and it doesn't want to go. Okay, so we're talking about now facts about cancer, right? African American women. Black women are more likely to die from breast cancer than our counterparts, right? Even though we have a lower incident rate. Black women have the lowest 5-year survival rate, right, than any other ethnic group. Only 78% of our Black women are likely to live beyond 5 years as compared to 88 of our counterpart white women. And there's a 6 to 8% gap in the 5-year survival rate. So I like to put those facts out about our Black women that's diagnosed with cancer. So who gets cancer, right? Anyone can get cancer. As I said, first off, that the cancer is genetic, right? So anyone is subject to get cancer. Some of the individual risks that people have to look at: the workplace, smoking, what is your lifestyle, and family history. So anyone can get it, right? So when we're talking about our lifestyle, such as what do you eat? How much do you exercise, right? Are you smoking? Okay, are you on drugs? And then what about the workplace? And when I say workplace and your environment, how stressful are you? I know a lot of us, we don't talk about the stress factor and the anxiety and how when you are highly stressed or anxious, how it affects the operation of your cells. WebMD stated that over 90% of cancers are observed to have some type of genetic alteration. Some of these alterations are inherited, while others are sporadic, which means they occur from environmental exposure, and usually over a long, long period of time. Now, how does cancer start? And I found this diagram, which helped me visually understand how cancer starts in the person's body. So when the cells mutate and grow out of control, they form a mass or tumor. Now, if we look at this part of the diagram, this is a normal cell division. We have a cell and it gets divided, right? And then it gets divided again. But as you can see right here, is we have one normal cell that's from the division, but then we have a bad cell from the division. Most of the time, this bad cell just simply dies, right? When this bad cell does not die, then it causes a cancer cell division and where the mutation starts. So if we look here, this is that bad cell, right? That bad cell now is mutating. And that's really how the cancer cells start mutating in our bodies, okay? So our next slide, now we're going to talk about stages, okay? Stage 0. This means that the cancer is still found in the place it started, right? And it hasn't spread to nearby tissues, okay? Stage 0 cancers are often curable. Yeah, okay, I'm gonna put a pin in that, right? Because I was stage 0 from my initial diagnosis, and I did have a recurrence, and it is all because of the genetic makeup in my body. Let's look at stage 1. This stage usually represents a small tumor or cancer that hasn't grown deeply into the nearby tissue. It's sometimes called the early stage cancer. Then we have stage 2 and 3. These are usually stages that represent large cancers or tumor that have grown more deeply into the tissue. They may also have spread to the lymph nodes, right? However, they haven't spread to other organs in the body. And then our last stage, which is stage 4, and this is the cancer in this stage, has spread to other organs or part of the body, and it may be referred as metastatic or advanced. Now, I want to really let people understand that stage 4, when a person says they have stage 4, or when a person says they have triple negative breast cancer, we always assume it's an automatic stage 4, right? That is not the case. When we have triple negative breast cancer, is defined as a cancer type that is very difficult to treat. It has nothing to do with it's an automatic stage 4. Okay? Stage 4 can be a lifelong treatment for the individual. One keynote is that it has spread beyond the breast, and it has spread to other organs, meaning that those other organs are affected, and therefore additional treatment is required. So now, let's look at some treatment types, right? So first off, we have surgery. Surgery is performed to remove the tumor or lymph nodes. Typically, surgery is the first suggested treatment, right? There are 2 types that a woman can choose from. We have a lumpectomy, which is considered a breast, conserving the breast. So they're only removing the part of the breast that is affected with the cancer, right? Or we have a unilateral mastectomy, meaning that the full breast is removed. Okay? Then we have chemotherapy. Chemotherapy can be given before the surgery, and all of this depends on an individual's treatment plan. Okay, there are occasions that the chemotherapy treatment is first so that it can reduce the tumor size, and then surgery comes after. Okay, it all depends on your oncologist and your treatment plan. Then we have targeted therapy. And these are specific characteristics of the cancer cells, generally less likely to harm normal healthy cells like chemotherapy. And sometimes there are antibiotics that's called immune targeted therapy. And one of the examples of that is the Herceptin that is mentioned, that is given to you after your chemotherapy treatment. Then we have radiation. We have two types of radiation. We have external radiation, where where that's a machine located outside of the body, and it's a high energy radiation to kill the cancer cells and shrink the tumor. A person can receive a daily treatment up to 6 weeks. Then we have what we call internal radiation. It's a radioactive substance sealed in the needle, seeds, wire, or catheter, and is put inside the body near the tumor, and it delivers a high dose of radiation directly to the tumor area to help spare the nearby tissues. And this treatment length is about 5 days. Okay. Now let's talk about reconstruction. Reconstruction options are implants, either silicone or saline. We have a tissue flap procedure, which uses the muscle and tissue from other areas of the body to form a breast, or we have a flap reconstruction, and there are other options for an individual. Maybe they don't want to have anything there, right? That's an option too. So it all depends on our patients and what they want. Then we have hormone therapy. Hormone therapy is typically, I think we can think of it like tamoxifen, right? Aromatase. Those are all medications used to temporarily stop the ovaries from making estrogen. Okay. So our next slide. Does cancer have symptoms? Sometimes, but not always. And I say sometimes, but not always, because oftentimes we have individuals that say, well, if I don't have a lump, if I don't feel anything when I do my examination, I don't have it. Or if I don't have any discharge or bleeding, then I don't have it. Okay. So the signs and symptoms of cancer depend on where the cancer is located and how big it is. Okay. So as we can see on the screen, if we look at our first letters of each one, these are cautions, if we want to remember it that way. Changes in the bowel, a sore that just doesn't heal, bleeding or discharge, thickening or a lump in the breast area, indigestion or difficulty in swallowing, obvious changes in the wart or mold, nagging cough or hoarseness. So other ones that's not listed here are unexplained weight loss, fever, fatigue, pain, skin changes. So keep in mind that these things will happen, but also remember that these symptoms are not only for cancer. So if you are having some symptoms like this, my recommendation is to make sure that you go and seek a doctor. So if you notice the symptoms, don't pass them up. it's time to get them looked at. Now, is cancer contagious? No, and I said that earlier when I started the presentation. You can't catch cancer from someone that has the disease. Cancer is a genetic disease. Okay, it's not like getting the flu or cold or anything to that nature. Okay, we can't spread it by touch. Is there a vaccine for cancer? No. However, there are vaccines for some viruses that are known to cause cancer, like HPV. Okay, HPV can cause cancer, and getting vaccinated against it can help protect against the types of HPV that can lead to cervical, anal, throat, and penile cancers, along with some other forms of cancer. Now let's look at some common myths. Now, are these myths or are these realities? Okay. Number one, you are not at risk of cancer if you have no family history. Is that true or false? Anybody? That's false?
False.
Yeah, that's false. As I said earlier, is that only about 20% of the cancer is hereditary, right? So that's false. Early stage breast cancer really rarely reoccurs.
False.
Okay. And that is, as I had also mentioned, is that I was stage 0, right? And I had a reoccurrence 8 years later. Finding a lump is the only breast cancer warning sign. That's another one. That's another one that's false, right? We just went over the different signs, the leakage. There can be a change in the breast. There can be bleeding, right? We can have weight loss, a fever. So all of those are other signs. When treatment is over, this is the one I really love. When treatment is over, you're finished with the cancer. No? We never finished with the cancer.
No.
Unfortunately, we're not always, we're never finished with the cancer. And I'm gonna, oops, go back, sorry. Oh, I hit my thing. So I had to find my notes on that. So facts, breast cancer can have a long-term impact on people's lives and our well-being. People with breast cancer often report that their family and friends expect them to be ready to move on after treatment. And we've all heard that, such as surgery, radiation therapy, or even chemotherapy. In reality, if a woman has decided to have breast reconstruction, they may be required to have several surgeries, right? And then for several months. I know I had, after my surgery, I have to have reconstructive surgery, and then I had to have another one because I had an infection. Okay, but some of these side effects from having cancer can be physical. We have pain, tightness, fatigue, skin changes, neuropathy, and all of this is after we finish our treatment, right? We can have menopausal symptoms. Other side effects can be mental and emotional. Okay, anxiety, fear, right? We have self-esteem, things we have to deal with. So no, it is never over. It's just a matter of what are we dealing with now? So, can cancer be cured? Well, some of them say yes when the cancer treatment appears to be working in a person. Yeah, that's true. Now, when cancer treatment appears to be working, you say the cancer is in remission. A partial remission occurs when the cancer shrinks but doesn't disappear. A complete remission means that there is no longer a sign of cancer. Now, this is what I have a little hiccup with. The longer cancer is in complete remission, the less likely it is to come back. And your doctor may say that it's cured. I have a little rub with that, right? Because I was stage 0, which means that I was supposed to be cured, quote unquote. But then 8 years later, it came back. Okay. So pardon me. So that's not always the case. As far as I'm concerned, is that if you've ever been diagnosed with cancer, there's always a risk of it returning. So we're never 100% cured. Excuse me. So now, when to get tested? Okay, so recommendations for these type of screening tests and the ages you should get them according to the cancer type. So it's a good idea to have a conversation with your doctor about the types of a test that you might need. So when we look at cervical cancer, it should start around age 25. So starting at age 40, we should have breast, cervical, colorectal, and prostate cancer should start at age 45. And I think that's very important to share this information with our men. And then at age 50, we are looking for screening for lung cancer. So these are important screening recommendations that we all should be aware of. So in closing, early detection is the key. I'm asking for our women to continue to do their self-examination and be your own advocate. If you feel like something is happening, be an advocate and go reach out to your PCP. And keep asking until you get the answer that you're looking for, okay? Know your body. That's very important, okay? Now, some of the data resources that I got was from American Cancer Society, CDC.gov, and foxchase.org. Okay, so I want to thank you all for allowing me to give you this presentation. And I hope this cleared up some of the common questions that we have about cancer in general and things you should do. Most importantly, be your own advocate. If you think something is going on, no matter it be cancer or anything else in your body, go to your doctor, okay? Once again, this is Cancer Support Team, where we empower, encourage individuals impacted by cancer. We host support group meetings for our survivors, our caregivers. We give away free wigs to our cancer patients. We give away care bags. So if you need support, please contact us, 708-580-6456. You can email us at info@cancersupportteam.net. You visit our website at www.cancersupportteam.net. We are asking for donations, and with your help, you can help us provide essential resources to those battling cancer. Join us in bringing hope to our cancer community. Thank you so much. Thank you, thank you, thank you. So I am stopping the presentation. Are there any questions, comments? You guys are not on Facebook. It's just me.
Okay, well, good evening, Karen and everyone else. I'm so sorry that I came in late and missed some important information, but I wanted to ask you, Karen, when you were discussing the stages, why is it that stage 2 and stage 3 were put together? I mean, I guess for obvious reasons, probably goes together, but.
Yeah, stage 2 and stage 3 are put together, and mostly because of the size of the tumor. You know, if it's a smaller tumor that has been embedded into the cells, then that would be considered stage 2. But if it's large, you know, a much larger, that would be considered stage 3. That's all. But the major difference is the size of the actual tumor.
Okay, so you're speaking about breast cancer, right?
Yes.
Okay,
Yes.
so for me, and I guess I would need to do my own individual investigative work for someone who has multiple myeloma, which is a blood cancer. I mean, I know that there are different types of blood cancers, and I have multiple myeloma, and that's why I was just asking about the stages.
Yes, yes, yeah. This, and I guess I should have made that clear, is that the stages is for breast cancer. Yes. Thank you. Thank you for that question. Any other questions or comments?
Well, what I wanted to say, Karen, I really enjoyed the presentation, because even though I am a breast cancer survivor, there were some things that you said tonight that I really didn't know. You know, I really didn't. So it was informative for me. And like you said, that's why I encourage all women, if it's anything that doesn't feel right, because when I went to the doctor, you know, for what I was experiencing, I had no idea they were going to say it was cancer. I mean, that was just like the furthest thing from my mind. So there's no rhyme or reason. I mean, it's not like, okay, if you have this, it's cancer. You just don't know. It's varied in so many ways. I mean, some of the statistics are the same, but the way women's bodies are and what they experience are so different. Even treatments are different. So, I mean, I feel blessed because, you know, the Lord spared me. I have friends who had breast cancer who, you know, didn't make it. But also, when I even think about treatments, sometimes, I mean, when people tell me they had 15 rounds of chemo and 33 rounds, that blows my mind, because I consider myself really lucky. I didn't experience all of that. So that's why I'm saying all that to say, just like you said, as a woman, you have to be your own advocate. If it doesn't feel right, if it doesn't look right, investigate it. You know, if you get a doctor, like I had to change doctors because the first doctor I had, in my opinion, didn't really care about anything. It was just kind of like, okay, you know, very nonchalant. And then I changed, and the doctor I had was amazing. I mean, to hold your hand, walk you through, make you feel comfortable, answer your questions type of doctor, you know. So, you know, all in all, I'm saying I just really enjoyed it, because there were some things, even though I'm a cancer survivor, that I didn't know until you just did your presentation.
Yeah, thank you, thank you.
Mm-hmm.
You know, like, um, that, you know, doing this presentation kind of came to mind because I am a co-facilitator with the UIC Breast Cancer Collaborative. And, you know, some of these things come up and people, like you said, I was unaware of a lot of this stuff. You know, when I was diagnosed, I was unaware. You know,
Right.
I didn't even know that I can actually question the doctor. Okay. You know what I'm saying? Because there are times where we feel that what the doctor says is law.
Mm-hmm.
And how dare you, you know, how dare you come and question me?
Mm-hmm.
You know, I have the disease. And one thing I've learned is that he may have 100,000 patients, but you only got you.
Right.
So
Right.
keep that in mind.
Mm-hmm.
Okay.
Mm-hmm.
So if he just having one of those days,
Yeah.
all right, we don't want you to be a statistic because he's having one of those days, right? And so if it ain't sounding right,
Mm-hmm.
if it ain't feeling right, you need to keep asking the questions. You know, keep asking the questions. There's a couple of other things about myths that I found out that I didn't know when I went through treatment, right? What about wearing underwire bras? They told us not to wear underwire bras,
Mm-hmm.
right? Or what about, have you heard this one about the deodorant can cause cancer, right?
Mm-hmm.
Those are all myths. Right?
Mm-hmm.
I have a couple of other ones that, you know, they're just simply myths that we believe, right? We believe. What about this one that all breast cancers are treated the same?
No. Mm-hmm.
And why I know? It's because my body makeup is totally different from the next person. And
Mm-hmm.
so I may respond to a specific treatment or drug where another person may not.
Mm-hmm.
Okay. So even though we're all under the umbrella of being diagnosed with breast
Right.
cancer, our treatment plan is individualized or should be individualized.
Correct.
Now, who do we listen to? Do we listen to, you know, your girlfriend? Because she had it too, right? Your girlfriend can give you questions, perhaps that you haven't thought about, you know, to ask the doctor. Okay. But her body makeup is different than yours. You know, another recommendation is that we should write down before we even go see our oncologist or our PCP. We should write down the questions that we have, and we should write down the symptoms that we're experiencing. Okay, we should write down the side effects that we're experiencing. Right, that will make our treatment plan much better when they are aware of the different side effects that we're having. Okay. Okay, I am going to thank you all so much. Are there any other comments? Okay, I am going to stop Facebook Live. And I'm going